am Rikki, Trisha, Therese, Badong, and today I am going to discuss about surgical removal of maxillary impacted canine, palatal and labial approach. On the abstract part, I describe about eruption problem of the human teeth. The maxillary canine was frequently to be involved in eruption problem and become impacted following the maxillary and mandibular third molars. When impacted maxillary canine is not susceptible to orthodontic traction or implantations, then surgical extraction is the most appropriate treatment. Objective: a case report of surgical removal of impacted maxillary canine which accessed both labial and palatal. Case report: a 19-year-old patient come to the oral and maxillofacial clinic with chief complaint of missing left upper anterior tooth and mild pain around the area since 2 years ago. There was a fluctuation on the labial mucosa. Panoramic radiograph were seen the horizontal impaction of the maxillary left canine. Introduction. Maxillary impacted canine have important roles especially in facial appearance, dental aesthetics, arch development, and functional occlusion. Impaction is defined as the failure of tooth eruption at its position in the dental arch, which the normal period of growth. Etiology: absence of lateral incisors, anomalies in the shape or size of lateral incisors, lack of guidance, ectopic position of the tooth germ, presence of obstacles to eruption, genetic factors, displacement of crypt, long path of eruption, impacted eruption due to a supernumerary tooth or an odontome, and retained deciduous canine. Radiographic assessment is a fatal method in localize the maxillary impacted canines, orthopantomogram, lateral cephalometry, CT and CBCT, or various forms for determining present location of the maxillary impacted canine. Classification of impacted maxillary canines. We have Archer's classification. First, we have the Class 1, impacted maxillary canine located in the palate, horizontal, vertical, and semi-vertical. Class 2, impacted maxillary canine located in the labial surface of maxillary, horizontal, vertical, and semi-vertical positions. Class 3, impacted maxillary canine located in both palatal and buccal alveolar bone. Class 4, impacted maxillary canine located vertically between incisors and premolars. Then Class 5, impacted maxillary canine located in edentulous maxilla. Case report. A 19-year-old female patient came to the oral and maxillofacial clinic presented complaining of missing upper anterior tooth. She reported mild pain around the area since 2 years ago. On palpation, there was a canine bud on the lateral vestibulum. So we have here a panoramic radiograph confirmed the impaction of the maxillary left canine tooth. Surgery was performed under local anesthesia. A full-thickness palatal flap was designed. A palatal approach osteotomy was performed using a round burr to expose the clinical crown of the left upper canine. The tooth was sectioned between the crown and root, and a vestibular aperture from labial was made with a small window osteotomy between the roots of left upper central and lateral incisors. The dental crown was luxated and removed all tooth segments. The operation site was irrigated with saline solution and repositioned the flap. Triple O silk suturing was carried out. Cefadroxil 500 mg 2 times a day for 5 days, ibuprofen 400 mg 3 times a day for 5 days, and chlorhexidine rinses 0.12%. The picture shows how we expose the impacted tooth from the buccal aspiration of left and removal part of the buccal cleft. The palatal plate was carefully raised to avoid making nervovascular condyle corresponding with the anterior palatal nerve. A palatal approach osteotomy was performed using a round burr to expose the clinical crown of the left upper canine, and then the tooth was sectioned between the crown and the root because the tooth positioning was very high and vestibular aperture from labial was made with a small windoostectomy between the roots of the left upper central and lateral incisors. Next, the operation site was irrigated with saline solutions and we repositioned the cleft. Triple O silk suturing was carried out and patient was given with surgical and oral hygiene instruction. This is the impacted maxillary canine after removal. The impacted tooth can be pathologic and managed in several ways. We have surgical exposure and surgical extraction. Management of impacted teeth. Establish a diagnosis, plan the treatment, and identify risk, assess benefits, and recognize alternative treatment. That would be all. Thank you.